future students to please try and have a balance. So although placement is a lot of hard work, try and keep your weekends free to do fun things, see friends and family, just relax. The second thing is that just try your best. You're still learning and mistakes will happen, but that's all you can really do.
One other thing that I really focused on was like not memorizing, but knowing all the background information for each child. And but it's very different when you actually meet the child. You will just forget everything that they may have, like their diagnosis, their everything. So just be with the child and engage in the sessions with them. Yeah.
Don't stress too much and don't resource too much, because that was something that I did a lot, like a lot of resourcing in the beginning, and then you realize you don't really use any of them, or you use the same ones repeatedly every week, so it doesn't really matter. And clinical reasoning into your learning goals, like every learning goal. Just limited. Don't stress. You've made it this far. You know as much as you can know. Now it's just letting things happen and thinking about it. And make sure you bring enough lunch. It's a long day. That's good.
Definitely do a bit of study before I came about frameworks, because I'd looked at it but very briefly and I hadn't really studied it properly since second year. So I think that's a huge tip.
Just a follow-up question, what are frameworks that you use the most?
We used a lot of co-op for QM, and then the overall things such as the biomechanical framework, the motor acquisitional.
Make sure you answer every question your CV asks you. Even if you don't know the answer to it, it's worth having a try. And also learn what proprioception means before going on a PEDS placement.
The first thing, a lot of it specifically to me, if you feel nervous or anxious about something, take a deep breath or take a few deep breaths, focus on why you're here and why you're doing this, and then just do it. No one is perfect or nails everything the first time they try it, and you will get better as you keep practicing. Ask for help, ask the people around you, ask your clinical educators, even if it's just to confirm what you already know and to make sure. Don't be afraid to ask for help. That's something that it took me a while to be confident with, but just even if you think it's a silly question, always ask for help. And the last thing I had one more thing. Don't compare yourself to others. Everyone has their own skills, so yeah, don't compare yourselves or your skills to other people's.
Study before you get here. Especially for paediatric clinic, look up your frames of reference, frames of reference, you need to know those. And also your approaches to how you would do an activity. So like your co-op, guided discovery, asking the child how they feel, learning through the movement, things like that. And your 4QM, know that as well. Those are the two biggest things that you should know before you get in here, because those first few weeks, the biggest learning curve is figuring out how all of those go into a session. And then like a diagnosis and child development, those are things that your CE's environment will help you to develop. So it's great if you read up on them a bit before you come in, and it's excellent if you already know them, but it's so much of a help to know your approaches and your frames of reference.
Alright, so I'm going to give you 2 tips for now, and I'll make a longer video and I'll put that somewhere. Check that out when that's up. Okay, so number 1 is know your frameworks. You are being assessed on your clinical reasoning, most likely. So having these frameworks and models to back up your clinical reasoning, even within your session plans. I know for us, we had a column for frameworks and clinical reasoning or client-related reasoning. It's really important to actually to use that theory that you've spent 3 years learning about and trying to absorb. Use it, because it actually helps you to create your activities and justify, why am I doing this? How does it relate to the goals? Really important. Number 2, know how you're being marked. So for us at our university, we use something called the SPEPA. So we probably mentioned that a lot throughout these videos. So it's a criteria, different things we get a score from 1 to 5 on, and ultimately pass or fail overall. Know what you're getting marked on and what they're looking for, because if you know what they're looking for, then maybe you can highlight these things. Oh yeah, so I talked to a parent the other day and it went really well. Can I describe to you, you know what they're looking for. Just like an assignment, you look at that rubric, you check things off. I've got my introduction, I've got this and this and this. Know what you're getting marked on. I can help you. And also to give advice to future students, what would they be?
There's toilets on level 5. You will find them.
Okay, we can't give that.
Because they have women's toilets. And there are 3 of them. See? And Talia's in the background just going, Jenny, you know this room. So yes, that's
Something more practical. For
that is practical.
No, but like